Hello friends. Once again news is coming from China about the spread of a virus. In the last few days, many such videos went viral on social media in which a large number of patients are seen in Chinese hospitals. Flu-like symptoms can be seen in these patients. It is being said that hospitals have become overwhelmed in many places. Crowds of people are seen in hospitals. The biggest fear among people is that will the story of COVID-19 be repeated once again? The coronavirus that spread all over the world 5 years ago originated in a market in Wuhan city of China. Now, according to China's official news website Global Times, the city of Beijing in the areas of North China and the city of Guangdong in South China are seeing the highest number of cases of this virus. The name of this virus is HMPV, full form of human metapneumovirus. On hearing the name, the first thing that comes to people's mind is what new disease has come, what new virus has come. But the truth is, friends, that this is not a new virus. It is an old virus which was discovered 24 years ago in the year 2001. On one hand, the origin of COVID-19 happened in the year 2019 itself. That is why it was named COVID-19, and it is believed that the virus came out of bats. On the other hand, in the case of HMPV, according to a research paper by Science Direct, this virus originated in birds 200 to 400 years ago. But since then till now, this virus kept changing itself again, and now this virus cannot infect birds. In the year 2001, it was first identified in the country of Netherlands that it can infect humans, and that is where it all started. You can say that now it is not like the virus was hiding for so many years and suddenly emerged in China in 2025. No, this virus is seen during every season. People often get this virus. They think they have a normal cough and cold, and after a few days the cough and cold get cured on their own, and they do not even know that they had HIV virus. This is the reason why it is also called anonymous virus. This is a respiratory virus. This is the reason why common cold and influenza have such similar symptoms. Exactly. People who get this can have fever, cough, blocked nose, and difficulty in breathing. The incubation period of this virus is 3 to 6 days. That is, if you have been infected only once, it can take 3 to 6 days to heal. When you get symptoms, when you get sick, how sick you will be and for how many days you will be sick depends on how serious the infection is in your own health. Children and elderly people may have more serious complications, such as they may also get pneumonia due to this. Now, the interesting thing is that according to Professor Paul Hunter of the University of East Anglia, UK, almost every child under the age of 5 years has already got the infection of HMP at least once, and after that they often keep getting reinfections throughout their life. This disease is so common that the way this virus spreads is the same as the way common diseases like cold and flu spread. This virus spreads through droplets emitted by coughing and screaming, or if an infected person has touched his mouth, nose, or eyes and then touched a surface, and you may have touched the same contaminated surface. It can spread through this as well. So from this you can understand what precautions you will have to take to protect yourself from this virus. According to Director General of Health Services, Dr. Atul Goyal, if someone is infected with HIV virus, then he should maintain distance. Use a handkerchief or cloth while coughing or sneezing. If you do not have a handkerchief or cloth, then use your elbow. Many people use their hands to cough or sneeze in this way. Using hands is wrong because whatever droplets are there will land on your hands, and you will use these hands only to hold a handle or press a button in public places. This is a big general advice, which is useful even when you have cough or cold. Always use your elbow while coughing or sneezing and wear a mask. In public places, if you go out somewhere, if you are infected. Apart from this, wash your hands regularly, whether you are infected or a healthy person. Even if you do not have the infection, your chances of getting it are reduced. If you do regular hand washing, because you often take your hands near your mouth and nose, and when you go to public places and touch different places, you will not get infected from there. As far as the treatment procedure is concerned, most healthy people will not need to do anything extra. Keep drinking water, stay hydrated, rest at home, and for most people, it will get cured automatically in 5 to 7 days or 7 to 10 days. The problem is more for those people whose immune system is already compromised. Due to some other disease or age, such people can have serious complications and may have to be admitted to the hospital. Actually, how deadly this virus is, how much fear do you need to have from it? We will talk about it. What is its death rate further in the video? But before that, I would like to tell you that no vaccine has been made for this HIV virus. It has been 224 years since it was discovered, but still no vaccine has been made. It is not that no efforts were made. Many researchers did try to make a vaccine, but there were problems regarding the safety of the vaccine and its effectiveness. Some of the vaccines were such on which animal trials were done. Studies were done on animals, but when given to animals, in many cases their lung inflammation became worse. The matter did not even reach human trials. This was one problem of safety, and the other problem was that it has been difficult to get long-term immunity. Cough, cold, common cold is such a disease that everyone suffers once or twice throughout the year. Let us know why this is: because common cold is not caused by any one virus. There are 200 different types of viruses due to which you can get cough and cold. Plus, all these viruses keep mutating constantly, and the immunity you get is not long-term. This is the reason why a common cold vaccine does not exist. But this is not a matter of concern, because many scientists believe that occasionally having a cough and cold is a way to keep your immune system active and responsive. Now the question arises that if this problem is not so big, then what is happening in China? China's National Disease Control and Prevention Administration has recently admitted that respiratory infections are increasing in their country, which also includes HHV. But China's foreign ministry says that the scale of spread of respiratory illnesses this year is less compared to last year. Experts say that the outbreak that is being seen at this stage does not seem out of the ordinary. Many countries often see a bad flu season in winters where lots of people get infected by the flu. Similarly, a bad HIV season is being seen in China. Now Indian media, along with the experts, has exaggerated this news a lot. It is shown as if another pandemic is about to come in the world, and the tension is going to increase once again in the whole world due to the lockdown, because now a new virus in China is spreading to HIV virus. Is lockdown going to be imposed once again? Look, the first case of HMPV was found in Bangalore. A 3-month-old girl and an 8-month-old boy. HMPV positive case of HMPV has now been detected in an 8-month-old child at a private hospital in Bangalore. Both these cases had no international travel history. These children had not traveled anywhere outside the country, which once again proves that this is not a new disease. After this, a case was found in a 2-month-old infant in Gujarat, and 2 cases came from Tamil Nadu. Then in Gujarat itself, a 180-year-old man was also found to be HMPV positive. But none of these cases had traveled outside India. Who is he? 734. Former Chief Scientist Somyu Swaminathan said that HMPV has been happening to people in India for many years, but there was not much talk about it. Now the talk has started. Media has taken this matter forward, and people are shocked.
I think people have not heard about this name very much. Therefore, perhaps it's come as a bit of a shock. And it's all local. It's not that it's come from outside or it's come from China. It's been circulating in India for many years.
He also said that keeping count of the number of people who have got infected with HMP is meaningless. It has no purpose. But a question still arises here, that how did these news from China become popular again today in 2025? Behind this? To some extent, the reason is China's zero-COVID policy when COVID-19 came. In China imposed a very dangerous lockdown. This lockdown in the whole country was more strict in comparison to other countries and lasted for a longer time. Due to this, the people there did not get any exposure to the virus for many years, and not only to the virus but also to other respiratory viruses and bacteria. There was nothing to keep their immune system active and responsive. The winter of 2023 was the first winter in many years when the lockdown was properly lifted in China. Due to this, the Chinese population suddenly got exposed to many viruses and bacteria, and suddenly different types of cases started. The number of cases started increasing. Due to not coming in contact with these pathogens for a long time, immunological deficit, i.e. deficiency in natural immunity, was seen. This is the reason why flu cases increased a lot in last winter in China, and this time once again a spike was seen in all these respiratory illnesses, but not as big as seen last year. The World Health Organization has also not declared HHV infections a global health emergency, but they are closely monitoring the situation. Quoting WHO, it was told that no mutation of HHV has been reported so far, due to which there is no possibility of any big outbreak. Experts in The Guardian say that HHV is not a virus like COVID. This virus has been present for many decades, so a level of immunity is already present in people regarding it. Those of you who are watching this video, this is also a big one. There is a chance that you too already have immunity against this HMP virus. Dr. Anish Jokarela, the nodal officer of Van Health Center, says that when children become 5 years or older, they already acquire a lot of immunity from this virus. Dr. Gagandeep Khan says that this virus can cause reinfection, but usually it is a mild infection. It can be serious either in very young children or in those whose lungs are damaged. Those who have chronic obstructive disease (COPD) or whose immunity is weak, others may have a long-term cough. But if there is nothing to worry about, then how deadly is it? According to a study published in the medical journal The Lancet, a total of 16,100 people died of HMP in 2018, out of which 65% were children below 6 months of age. This means that most of the people who are dying from this virus are children under 6 months of age. According to this paper, children under 1 year of age are most at risk due to HIV. How many deaths have occurred in October? It is difficult to know the exact death rate due to HIV because the data of many respiratory diseases overlaps with it. But what about HIV? Spokesperson Margaret Harris says that the risk of death in HIV cases is very, very low. It is very, very low, but very young children under 1 year of age, have delicate airways which can get blocked by this disease. And their immunity is also low. It can be difficult for them to fight this virus. If you compare it with COVID, then your chances of dying after getting COVID infection are 0.28%. This is also called crude mortality rate. That means if 1,000,000 people have got COVID, then 279 of them have died. Obviously, this is the average of the whole world. The exact rate depends. Which region do you live in? How is your health? Access to the hospital? How are the facilities of the hospital? If this rate is compared with flu or influenza, then out of 1,000,000 people suffering from influenza, only 1.8 people die. That is a mortality rate of 0.0018%. Whereas if the data of influenza and pneumonia is combined, then out of 1,000,000 sick people, 14.1 die. On an average, a mortality rate of 0.014%. So in the case of HMPV, we do not know the exact rate. But by looking at these numbers, you can definitely guess that the mortality rate of HMPV will be closer to influenza and pneumonia. It will be far away from COVID. Overall, the hype created on the Indian social media regarding this virus is a bit too exaggerated. It is true that it is difficult to get reliable information out of China because there is a lot of censorship there. But India Today analyzed China's social media website Weibo and found out what people in China are talking about on the virus and MPV. They searched for keywords like HMP virus death, lockdown, curfew, and according to their analysis, it came to light that the spread in China is not as lethal as it is being shown in India. There is no science behind imposing lockdown restrictions, and China itself says that the number of overall HMP cases is less than the number of previous flu seasons. Fear-mongering spread in India regarding HMP. Due to that, panic selling was also seen in the stock market, due to which investors suffered a loss of about 11,000,000 crores. So do not panic too much, follow the regular hygiene precautions that I have mentioned, and pay attention to the fact that there are much more serious issues in